I'm working in a university to teach students and also bring clinical practice in the university dental hospital. So we can, we're dentists, yes, we can meet this kind of lesion very much in our clinic. I'm sorry, tooth is very short and very hard, but will bend during occlusion, during mastication, and it can cause some virtual stressor and some compressive and tensile strength, and it is focused to the cervical area and make some fractures in there. And also there are added outrage and erosion. So this kind of a region has evolved from the kind of condition. So we called it a fraction or non-carrier cervical lesion, NCCL. Usually we call it NCCL. After restore the composite resin to this kind of a region, we can find some complaint after treatment, some easy exfoliation right after treatment, or patient feels some hypersensitivity after treatment. It's because the continuous mastication force are loaded to the cervical area, and also this is not a cavity, so the mechanical retention form is not exist, so it can easily exfoliate. And also the surface of dentin is very sclerotic, it's glass-like. It's not good for bonding, but also have a hypersensitivity in there. And also, in the circuits, in the gingival circuits, circular fluid will continuously go out. So it's very hard to make a good bond in this condition. So also the adhesion of this lesion is more important compared to other posterior area. So in this session, I will show my clinical procedures to treat this kind of cervical lesion, and also explain why I do like that. And also I will show some small hands-on demonstration after presentation of this slide. Okay, here's my patient. He has a very severe NCCL lesions, many tears. Some tooth has a shallow, percentage is very deep, and also there's some fracture and crystallizing here, very severe NCCL condition. First step of treat this kind of lesion is packing gingival retraction cord. Gingival retraction cord helps to reduce margin of the lesion and also prevent contamination from circular fluid. After packing the gingival retraction cord, I prepare the enamel and dentin surface. Prepare enamel surface using high-speed diamond and also low-speed round covering board to the dentin area. As you know, composite resin will shrink during polymerization during setting. So it can make some problem. Shrinkage can make a poor adaptation at the margin and the internal area to make a micro leakage, and it can cause some secondary caries, and also make some post of hypersensitivity during mastication when the bond strength is lower to the shrinkage force. When bonding strength is more higher than shrinkage force, it can make some micro crack or some possible fracture. So the shrinkage, we usually should think about the composite resin shrinkage. You can feel very easy shrinkage of the composite resin like this. Put some composite to the fingertips and like here, you can feel the composite move pulled out from the fingerprints. You can easily feel the shrinkage of the composite resin. So there's a concept of a configuration factor. We call them C factor. Bonded surface will hold the composite resin during the shrinkage. They hold the movement of the composite resin during polymerization. So the stress will be happening there. But not bonded surface. Unbonded surface will move freely during polymerization, so there is no stress and they can relieve the shrinkage stress. So, more bonded surface means more shrinkage stress, and more unbonded surface means less shrinkage stress. So, think about why we should prepare the tools before we make a restoration. First is defect. Yes, bonded surface will be increased, but at the same time, unbonded surface will be increased much more compared to this situation, so that we can reduce the defector, and also we can remove sclerotic or erosive dentin in there, make a clean dentin surface, and also here is a very sharp area. Sharp internal area is the focusing point of stress concentration, so we can remove that point. And also, if you do not prepare, there are less enamel area. As you know, enamel has a higher bonding strength compared to dentin, so we can make more better bonding to structures. So I did prepare the tools with a high speed or low speed for us. And also, preparation of margins at the enamel margin makes the better color transition or color blending. So compared to this is original shape. I remove enamel area, makes it more broader bonding surface. Also removes the sclerotic dentin here. And then we have to make some preparation for the bondings. First is apply acetic etchant. I use 37 phosphoric acetate. And as you can see, not start from dentin surface. I draw the line to the enamel area where I fill acetic etchant. Go margin and here the area. Not from the dentin. Start from the enamel. Make a boundary and fill the enamel area, and then goes to the dentin. But in this time, I fill dentin area very quickly to make etchant contact with the dentin, all the surface at the same time, very quickly. Enamel just drawing, not so fast, and fill the enamel area, but now I fill the dentin area very quickly to make contact at the same time. If you use total etcher adhesive, you should apply acid etchant to the dentin, but if you use other adhesive, there is some different situations, so I talk about that. Known as first generation of a dentin adhesive system is consists of etching, priming, bonding. And another etching product, fifth generation, has a priming and bonding in one bottle. So we call the fourth and fifth generation, which is etch and rinse technique. Using etch and rinse technique, we call it total etch. They etches enamel and dentin. But sixth and seventh generation do not etch the enamel or dentin. They only apply their adhesive, never rinse it, and so we call this self-etching. So this is 6th, 7th generation self-etching adhesive, we call it. And also nowadays we use universal adhesive. This universal adhesive can use total etch or self-etch style, and also they can bonded to structure and also other resin materials and then other restorative materials. So we call it universal adhesive. So if you use self-etch adhesive, you don't have to etch the enamel, but I highly recommend to use the acid etchant to the enamel. This is selective etch technique, etching the enamel area, not the dentin area, because if you apply only self-patch adhesives to the enamel area, you cannot make a better bonding to there. So it is better to use exudation only in enamel, even though you self-patch adhesive. And also universal adhesives can use like this select-batch technique. But if you total etch adhesive system, you should etch enamel and dentin area at the same time. And also, if you use universal adhesive, you can use this kind of way. So it's different from the product of adhesive. And also, if you over-etch dentin area, collagen fiber is exposed to very long area. But if you apply adhesive very short time, adhesive cannot penetrate to the etched collagen fiber network. That means that bonding will not put in here, and the durability of bonding will not put here. So I start enamel etch first, and then go to dentin, apply exudation to the dentin, very short. Enamel can withstand 15 to 16 second exudate application, but dentin is not good for the 15-60 seconds, not good. So I try to make it not over 5 seconds to the dentin. After exudate application, we should remove thoroughly by wash with water. And then dry. You have to dry the surface. When dry the actual surface, you should make this kind of white chalky area in the enamel area. But in dentin, you should not over dry the dentin surface, because if you over dry the dentin, the collapse, actually collapse, and actually collagen fiber will collapse like this, and all this cannot penetrate this collagen fiber network. So you should not over dry the dentin. Dentin should show the shiny bright in here, but enamel should dry well. Looks like this, chalky white appearance you should make. And then we apply the adhesive. I do use universal adhesive here. When I apply the adhesive, I start from the dentin area, not from the enamel area, to give a time to avoid this infiltration to the collagen fiber networks. And then apply this to enamel area. I highly recommend not to use this kind of a small jar. Put some adhesive here. It can be light cured in ambient light, and also adhesive has a volatile property. Volatile means dry very fast. So if you put some adhesive in here, the adhesive will be dried and get thick, and they will lose the penetration ability to the collagen fiber network. So I highly recommend direct apply adhesive to the brush and go to surface, not put into the small jar. After that, after application of the adhesive, I remove excessive adhesive from using the same brush what I used during application, and go to gauge white paper, make brush dry, and go to toothsel again, remove excess, and go to make it dry, and go back 3 or 4 times repeat this kind of procedure to make a remove excess of adhesive. And it can also promote adhesive infiltration in dentin area by agitating. Agitating motion improves the infiltration of adhesive to the collagen fiber network. And in the time, never blot out the enamel area, only the dentin surface. Blotting the enamel can break down the etched enamel surface, so blotting on the dentin area. After the air dry the adhesive to remove the solvent in the adhesive, and then light cure. First layer of my composite restoration is a flow blade. flow resin to the dentin surface, not analysis. Flow resin very thin and apply to the dentin surface. This flow resin will cover the bonding surface and protect the bonding surface. And also, after apply flowable composite, it is much more easier to apply another composite resin on it. And also, thin layer of flowable composite can reduce shrinkage stress. They observe the shrinkage stress compared to the type of composite resin. And then I add the composite resin 2 or 3 layers and make a contour. After making contour, we should go into the finishing to make the contouring using a high-speed diamond or high-speed stone board or whatever low-speed always this kind to use. And then make a polish and make a shine. Then also you can use this kind of silicone point. I use silicone point to make a polishing to the surface. And remove the reflection cord and then refine the margin and then polish again. And this is the final. I use only A3 color for the composite resin. Result is not, wonderful, but it is acceptable, I think. So I will use only one color of composite resin. And this is another case that I use only one color A3 used for this various lesion in the cervical area. And this is my final case. Here is severe cervical caries. I remove and using the same technique which I treat NCCL with one color A3. Yeah. That's a beautiful, but it's acceptable in this color. Okay, this is my final slide, and then I will go directly to the hands-on demonstration. I already prepared the cervical lesions in this canine, and we cannot use acid etching because we cannot use the water. So let's think about it. This is the etching situation. First step to restore with the composite resin. First step is applying the adhesive. I will use this universal adhesive K-bond. You can easily open this cap with one hand, like this. And you can use it very easy, comfortably. And directly apply to the brush. And close cap. And apply adhesive etching surface of cervical area. And I will remove excess by drying brush at the dots. Now remove excess, go back to the make dry brush, and remove agitating dentin surface. And the light curve. Light curve 10 seconds. Okay, and then apply floor composite to the dentin area, not enamel area, to the dentin surface. As thin layers of oil, I do not use instrument, I do use only tips of floor composite. Like this. You can make easily right shape for the floor composite. And then like this. After then, I will apply composite resin. In this case, I will use this 250. It has a very unique capsule here. You can open this cap by one hand, like this. It has a a beautiful V-shaped notch in here. You can cut composite resin very easily, very comfortably. Make the sun shade in here and remove and close cap by one hand. And you can apply composite resin to here and make a shape. Usually in cervical area, I added 2 or 3 layers to make a contour. If the lesion is more larger, you can add more and make a change the colors of composite resin. Make a contour in right here. And then after you make a contour, you can make a polish and finish polish and make a shine and remove depression cord. And this is the end of my presentation. Thank you for your kind attention. I hope you have a good time in this beautiful exhibition. Shukran. Thank you very much.